Hi, my name is Chris. Today I'm going to be talking about GOG 204. This is going to be in the landscape of advanced recurrent or persistent cervical cancer. So GOG 204 came out in 2009, Monk et al., and this is a landmark trial. What it was doing was it was a head-to-head comparison of different types of arms for the management of advanced recurrent or persistent cervical cancer. The reason why the trial was started was because there was two phase 3s before this trial came out, and that was GOG 169, which was Cis and Taxol versus Cis, and then there was 179, which was Cis and Topotecan versus Cis. There was also two phase 2 trials that came out that was using Cis and vinorelbine or Cis and gemcitabine. So GOG 204 takes all those different arms and compares them head to head, while each of those additional prior studies was either that treatment versus the just Cis alone. So an important thing for the study, so they were trying to accrue 600 patients, and that was giving it the ability to have an 80% power to be able to detect either a partial or a complete response compared to the reference arm, which was going to be Cis and Taxol. There was also importantly an interim analysis built into this study, which at 232 deaths, they're going to assess and see if any of them were superior. So in brief, here are the results of the study. The important thing to note is that at interim analysis, this study was stopped because the overall survival was not superior in any of the arms compared to Cis and Taxol. Numerically, it's important to note that Cis and Taxol had a longer overall survival and also a longer median progression-free survival, although these both were not significant. So at time of interim analysis, the study was stopped. It ended up being decided that Cis and Taxol was going to be the standard regimen for patients who had advanced, persistent, or recurrent cervical cancer because none of those other arms ended up being superior to Cis and Taxol. So last few notes of the paper. So there was a trend that favored Cis and Taxol, but important risk factors were Black race and target lesions in prior irradiated zones were prognostic for overall survival as well as progression-free survival. Measurable disease in a radiated field had a 41% greater risk of death, and that hazard ratio meant that it was 1.41. So that was the breakdown of GOG 204. The more you know.